My name is Dr. Kim Reiss, and I'm a medical oncologist with an expertise in pancreatic cancer. I would like to tell you about an important clinical trial called the APOLLO study for certain patients with pancreatic cancer. APOLLO is specifically for those patients who have had surgical removal of their pancreatic cancer and have recently completed all their standard therapy, including surgery and any chemotherapy or radiation that was prescribed by their doctor. To qualify for the APOLLO study, patients must have a known mutation in either BRCA1, BRCA2, or PALB2. Genetic testing, which might identify these mutations, is recommended for all patients with pancreatic cancer and can be ordered by your doctor. The standard approach for patients who have completed surgery and chemotherapy for early stage pancreatic cancer consists of close monitoring and with imaging, blood work, and clinical visits. Unfortunately, pancreatic cancer has a high rate of returning. In this study, we are attempting to lower that risk for those with BRCA or PALB2 mutations. Patients who enroll in the APOLLO study will be assigned by chance to one of two groups. Group 1 will receive a PARP inhibitor called olaparib for 1 year, and Group 2 will receive a placebo pill for 1 year. Each patient has a 2/3 chance of being in Group 1 and a 1/3 chance of being in Group 2. Neither the patient nor the doctor will know which group the patient is in. The goal of the APOLLO study is to assess whether giving olaparib for 1 year leads to better results for this group of patients. Olaparib is a class of drugs known as a PARP inhibitor. These drugs have been shown to be effective in patients with metastatic, incurable pancreatic cancer who have a BRCA2 or PALB2 mutation, as well as for several other cancers that are associated with BRCA. Importantly, a recently published clinical trial called Olympia showed that patients who took olaparib for 1 year after completing all their surgery and other treatment for early stage BRCA-associated breast cancer lived longer than those who did not. In the APOLLO study, we're using the same drug for BRCA and PALB2-related pancreatic cancer and are hoping to achieve the same results. Olaparib is taken orally and is typically much less toxic than regular chemotherapy. For this reason, patients will be able to take this drug even after having been through chemotherapy and surgery. A patient who decides to participate in APOLLO will first meet with a nurse or doctor to review the requirements and discuss the possible benefits and risks of participating. This process is known as informed consent. Patients who qualify will then be assigned by chance to one of two groups. Importantly, again, each patient has a 2/3 chance of being in Group 1 and receiving olaparib for 12 months, and a 1/3 chance of being in Group 2 and receiving a placebo pill for 12 months. The placebo pill is a pill that looks like the study drug but contains no medication. Placebos are used in clinical trials to help researchers determine the accuracy of the results without bias. They are never used in place of standard of care treatment, but they are sometimes used when a drug is added to the standard of care approach. After a patient finishes their study treatment, their doctor will continue to follow them for up to 10 years and perform routine imaging and blood work. Clinical trials are done to try to answer questions about how to prevent, diagnose, and treat diseases like cancer. The APOLLO study has the potential to help you and to make significant mark on patient care. Specifically, it may improve the future of pancreatic cancer treatment for those with BRCA or PALB2 mutations. At the end of the day, it's about making sure patients are getting the best care possible. To learn more about the APOLLO study, please speak with a doctor or visit the link on the screen.